I am Dr. K Hariharan, diabetologist, 𝐃𝐁𝐄𝐓, Chrompet. In continuation on the deliberations regarding diabetes in the eve of World Diabetic Day on November 14th, I want to clarify three terms: hyperglycemia, hypoglycemia and 𝐓𝐵A1C. These terms, people are a little confused about them. Hyperglycemia is simple. Diabetes is hyperglycemic state, a state where the blood sugar is more than 160 or 180, the case may be. So you don't have to specifically say hyperglycemia. You say diabetes. We all understand that you have got increased blood sugar. This is normal in all diabetic people, but if the hyperglycemia goes very high, like 500 and above, where your reading shows high, this can lead to a condition called diabetic ketoacidosis, which is an emergency in diabetes. This occurs in people who have very poor immunity and who have got concurrent infection, urinary infection or a respiratory infection. This has to be treated. This is the only condition mostly where hyperglycemia is an emergency. On the other hand, hypoglycemia, a condition where the sugar is below 70, is definitely an emergency. Hypoglycemia, you have to rush to the hospital, and then they will give you a glucose infusion and make you all right. For this, you have to have home monitoring of blood glucose, the blood analyzing device which people have, glucometer. Now, regarding 𝐓𝐵A1C, nobody has properly told me what 𝐓𝐵A1C. Everybody will say 𝐓𝐵, something like that. I don't know. Somehow or other, they are not able to grasp the full term properly. It is glycosylated hemoglobin. What is this? The essential pathophysiology of diabetes is that there is increase in glucose, as a result of which every cell in the body, the glucose becomes a poison. It denatures the proteins, all the trillions of cells. This denaturing is responsible for most of the complications of diabetes, of microvascular and macrovascular complications. How to assess this? Very simple. God has given a simple mechanism whereby the hemoglobin, the hemoiety in hemoglobin in the blood is easily accessible and assessed. Like all protein, this heme is a protein. This is denatured. If you can see how much denaturing it has undergone, it is a reflection of what is happening in the rest of the body, on the basis of which we can find out what is the state of affairs in the whole body. So, 𝐓𝐵A1C, this has to be done once in 3 months. Simple, because the lifespan of the RBC is 120 days or 3 months. So, it dies and new RBCs are formed. So, that is why it is being done once in 3 months. Regarding the interpretation, if the 𝐓𝐵A1C value is less than 5.6, jolly well, you are not a diabetic. Suppose it is between 5.6 and 6.5. Say you are a borderline diabetic or your diabetes is well under control. If it is between 6.5 and 7, it's a fair control of diabetes, and above 7, it's a poor control. If it is greater than 10, 13, you are in absolute danger. You have to take immediate measures to bring down, because hyperglycemia definitely affects the heart mainly. You are prone to get heart attack in these cases where the A1C is very high. So these terms have to be clear if you have to know something about diabetes. Thank you for your patient listening.